He had left-sided deviation. He couldn't talk. He started guppy breathing, and it was just pretty incredible.
Did you just say guppy breathing?
Yeah, you know, like
is that a technical term?
I think so. Yeah, it looks like a little guppy fish when they can't get oxygen.
Jamie, I'm sorry to break it to you. That is not a technical term.
That's my technical term.
Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey. Welcome back to the nursing news, you guys. I'm telling you, this is a special episode. I know it's extra juicy long, but this is a special nursing news, and I'm doing it another duo nursing news episode, and this time is with Jamie from what's it called? First Do No Harm podcast. I know it's called First Do No Harm, but we did some damage, man. I just finished editing it, right? And I'm telling you, we deep dive on some real sensitive topics. We deep dive on some really important topics. If you can hang in there, watch the whole thing. We talk about all the juicy subject. We talk about taking care of a patient that wears a Confederate flag. We talk about J&J paying that $527 million, but now I think they just tried to sell it for $20 million. Can you believe that shit? We talk about kids' parents who lost custody because they didn't want to continue chemo. We talk about some of the most important, juicy, ethical, questionable topics I've ever talked about on a podcast, on a YouTube video. You guys are going to love this. Hang in there, watch it, and please, most importantly, go check out First Do No Harm podcast. Jamie got the best out of me, and you know that I'm talking to you guys 24/7. So if she could do that for me, imagine what she could do for you. Listen to me. This is good stuff. Hang in there, and thank you to the world. Don't forget to like, comment, subscribe, no matter if this is the YouTube or the podcast. I love you guys. Catch you on the flip. A 4-year-old was taken away from her mother because she had leukemia and what?
Okay.
Was this the one with she didn't want to do the blood products?
She stopped the chemo itself. So what happened was there was this 4-year-old kid who got diagnosed with leukemia.
Okay.
And they started treatment, and she thought that her son, from what I've read, it looks like her son was getting more sick. And I mean, you know how chemo goes because we're in the field of nursing, right?
Yeah.
I feel like there's probably a big lack of education on the side from nurses and doctors. But anyhow, they decided that they didn't want to do it. They were going to drive to Ohio, and the state, they decided that they kidnapped the kid, their own child.
No, pause. I'm super confused.
Yeah.
Jamie, I'm confused. Wait, who's kidnapping the kid?
They're the kid's parents.
Because the state said that the kid needed to go through with the...
Right, to finish the chemo. And they're like, no, we want to try more of a homeopathic route because our son's getting sicker.
How is that even legal?
Okay, I agree with you completely. So it gets even crazier. Then they not only got in trouble because they decided they wanted to go the homeopathic route for their kid, right? They want to do like oils, they want to do whatever. The state took away custody of the child from the parents.
So that's why it was considered kidnapping.
Well, yeah, because they took away custody from the parents because the parents didn't want the kid to finish treatment.
How old was the kid? Do you know?
4.
Do you remember?
4 years old.
4 years old? Oh, Jesus Christ, this is really difficult because I know many situations of Jehovah's Witness parents refusing blood products, which then led to kids passing away. Mm-hmm. Many situations where these non-vaxxers decide not to vaccinate the kid get measles, get mumps, crazy situations like that. I don't understand. So first of all, I did not hear about the story. Second of all, I don't understand how it's possible to take. It's the parents, like they're the guardians. You can't take that away from the parent. I don't even understand why that happened. Look, first of all, I have to just say this to, like, if anyone's listening, like, you have to understand that I am hardcore science fact based. Like, I'm all evidence based. So
Same.
If I were to sit down and talk to those parents, I would have been like, look, your kid needs this chemo. All right. This CBD oil rubbing, praying stuff, do it extra, but the kid needs the chemo. But at the end of the day, the parents get to make that decision. Mm-hmm. The state can't make that decision. That is insane.
Yeah. And
I did not hear about this. Oh my God, Jamie.
Yeah. And I understand. So a lot of people, they side as far as, well, you can force children to have vaccines. But the thing is, vaccines protect other children. It protects a community of children.
Yes.
This is specifically only for this child. Like, by not finishing chemo, it doesn't hurt anyone but your own child if it hurts them. Now, there's a 98% chance of these kids with leukemia that they go into remission. So I understand that. But then again, on the same way, I also feel like this is going to be a very slow fade, because then how can government agencies not decide then that you can't pursue more treatment? You know, like, you have an elderly person and the family says, okay, we want them to die peacefully. And they're like, no, we should probably start a levo drip and we're going to sue so that we can keep their blood pressure up.
Yeah, no, that's a really slippery slope. That's a very, very, very slippery slope. And the thing is, you're right. Like, vaccines protect other kids, and even vaccines, you can't force. You could tell someone you can't come to this public school without taking your vaccine. You can't join this camp without getting your vaccine. But you can't take a kid away from a parent because they don't want to do vaccines for that kid. So to take that step and make it applicable to a kid getting chemo is a huge step. And you're right. It just, that becomes the most slippery slope I've heard in ever. Then I can decide, nope, your mom needs to be a full code. We don't want her to be DNR. Nope, your mom or your sister or your kid needs to be it's ridiculous. You said that this happened in North Carolina?
No. This happened in Florida.
Oh my God. Why does everything crazy happen in Florida? Jamie, have you been to Florida?
What's wrong with Florida? I haven't worked in Florida, though. That wasn't on my list.
Well, good for you. I mean, Florida, there's always something spicy. I do this nursing news, and every time I'm reading about a crazy nurse, a psycho nurse, a something nurse, it's always someone from Florida. Florida does things a little bit different than everybody else, but that's a crazy story.
What's your background as far as nursing and healthcare goes?
So I'm brand spanking new into healthcare. So I'm 25. I've been a nurse for 2.5, 3 years right now. So that's just straight out of college, just what I've been doing. Started out, while in nursing school, I did do one-on-one home care. So I just had one patient. I did one-on-one home care, and I loved it. I really like any type of nursing that allows you to spend a long period of time with a single patient, right? Yeah. And that translated into my assisted living. So it was one-on-one home care. Then it went to an assisted living. And this was still when I was in nursing school. At the assisted living, same situation. It was literally the entire time I was there. It was the same patients. And it really is Jamie, I love getting to know my patients and knowing them on a level knowing them on a level beyond the prognosis, beyond the diagnosis. I like knowing, oh my goodness, your kid John came to visit you today. I saw him and he left this for you. I love knowing that about my patients. So that was really nice. And then I took the next step from that. As soon as I became a nurse, I worked at a rehab, an acute rehab. So it was, I think the longest someone was there was 2, maybe 3 months, but the average length of stay at the acute rehab hospital that I was probably about 2 weeks, which is enough because it was an acute rehab. So you had patients on drips, you had patients, it was a full, basically hospital type situation. They were just there for about a week and a half, 2 weeks. And then from there, I jumped into the hospital. And that was my second nursing job and the job that I just ended prior to starting to be a travel nurse. But at the hospital, I worked at a cardiac floor, and you know how that goes. That's a 2-day, 3-day stay. If that, chest pain, bypass surgeries, cath lab, EP lab, pacers. That was the very short hospital acute care stuff you see on TV. But everything before that was, I don't know. Because the thing is, I'm sorry, I'm going on. Do you care? I'm sorry. The thing is, I really enjoy the long stays, but the adrenaline of working on a cardiac floor, oh shit, there's nothing better. There's not, and I feel like because I'm young and because I'm just new to this and I want to learn all my skills and I'm excited and all that stuff. That's why I decided on travel nursing, because my whole thing with travel nursing is I want to do one 13-week assignment at a place. If they like me, if they're comfortable with me, I'm going to ask them to do a second 13-week assignment at that same hospital. But I'm going to say, look, I want to stay, But if I stay, I want to do ortho. I know I don't have any ortho experience, but I was here for 13 weeks. If you trust me doing ortho, I'll stay another 13 weeks. If you don't trust me doing ortho, I'm going to bounce to somewhere that does.
Yeah.
If they say yes, I'll get that ortho experience, or I'll go to chemo experience, or I'll go to something so I can just build on my experience of different floors and different things. But
they have a lot of float pool positions. Like you get your first assignment under your belt, and then float pool is the way to go if you want to do stuff like that. And you learn so much because they're not going to give you the craziest and like most difficult assignment right away. So you have like time to learn, and there's a great learning curve.
I like that idea.
Yeah.
I have to ask you a serious question about float pool. So it sounds like you did do float.
No.
You never did a float pool position?
No.
Oh, okay. So what were your positions when you traveled?
Neuro ICU was my specialty.
Neuro ICU?
Neuro ICU. Yeah, I love the brain. I love the elderly population. I love, oh my goodness, do I love elderly people. I just want to kiss their little cheeks and hug them and listen to their stories. And neuro, you have to get to know your patients so in depth that if there's any small change and the vital signs won't reflect it,
yes,
you just know that something's different. And sometimes that's the difference between them having a forever injury and, being able to intervene.
Yeah, no, you're right. Because a lot of the times, even like in nursing school and when I worked at the acute rehab, I worked on the brain injury, stroke floor. And every time my nurse manager, my nurse professor, my preceptor, every person that was in charge always said, in the elderly population specifically, even yes, obviously on a brain injury floor, but in the elderly population specifically, cognition is the first thing to go.
Oh, yeah.
And a lot of people are like, homegirl is, grandma is just old and she's forgetful. Or grandpa is just, he can't hear you and he's senile. No. Mm-hmm. Things are happening, and you need to keep an eye on the prize. But when I don't know, I just feel like that's one of those situations where we as a profession need to start, I don't want to say start respecting the patient's family more, but at least start hearing them out a little bit more.
Oh, man. Yeah.
Because it's always they come in and they're like, this is not my dad. This is not my uncle. This is not my husband. This is not what they usually do. And you're like, yeah, that's because they're in the hospital. But no, hold on. Just hold up and just give that lady, the significant other, that family member, a second to explain why she is a little concerned. Because maybe, that could be, the doorway into, let's do a CT scan. Let's just do a brain MRI. Let's see what's going on.
I do rapid response now nursing over at UNC Rex, which that is by far the coolest gig I've ever had. And I worked at Johns Hopkins as well. I worked at the largest neuro ICU in the world. It was a 64-bed neuro ICU out in Phoenix. But this gig is incredible. But I got called for a possible stroke and ran up there. Went through my quick assessment. And of course, you always ask, well, does this patient have a history of dementia or Alzheimer's? Do they sundown? It was an older person. And the family's like, no, he's sharp as a tack. And I was like, okay, cool. And then he started waking up and he was doing great. And they're like, oh, he's back to normal. We're good. And I was like, no, we're not good. We need to go down. So pack him up off the floor. We're going down to CT. The guys, I think it was his right ICA completely occluded. So from the time to the floor to the CT, he had left-sided deviation. He couldn't talk. He started guppy breathing. And it was just, but the family, they were right on it. They're like, nope, this is not him. This is not, yeah, it was pretty incredible.
Did you just say guppy breathing?
Yeah,
is that a technical term?
I think so. Yeah, it looks like a little guppy fish where they can't get oxygen.
Jamie, I'm sorry to break it to you. That is not a technical term.
That's my technical term. Agonal breathing, but they look like a guppy.
I love that. I've never heard that before. Do you guys say that, or is that just you? Is that
I think it's probably just me.
I love that.
I'm starting a trend. And put the picture in your head, though.
Breathing.
You can see it, right?
Of course. I know exactly what you're talking about. That's fantastic.
Yeah, so like this, you worked in enough areas that I mean, just for instance, there's times where in the ICU that us as nurses and even physicians were like, this family really needs to make this patient a DNR. We need to remove the ventilation, like tracheing and pegging the patient. They're not even gonna be able to go to like a long-term acute center or like a skilled nursing facility or any of those places. But yet we don't get to make that decision, even though we know that's not a good for everything. We're going to make them suffer maybe a week longer before we can't do anything else. So, like back with this kid, how does the parent not get to decide this as well,
decision. Yeah. I mean, I would respect it. Like if I went into the details of that story, and in that story they said they talked to the parents said no, the nurse, the doctor, the therapist, the case manager, all 10 people in the interdisciplinary team decided that this is an ethics board reason, and they took it to the ethics board, and then the ethics board decided that, like, if they went through every hoop to make sure that, like, no, this kid needs this chemo, maybe that's a situation I'd be able to understand. Right. But at the same time, even going through all of that stuff, you need a legitimate reason. You need to prove to me that the parent wants to harm the kid before you take that right away from the parent. Right? You need to either say, oh, that parent they have some psych issues or addicted to alcohol. Like, there needs to be a legitimate concern with their mental status before you take that right away. You cannot do that. I mean, that's like the ultimate right, is like what you get to do for your kids. I don't, right. I don't know, James, that's something that would be an issue for me. Like, wholehearted issue. Like, I don't think I could work on this unit. I don't think I could continue to work on this floor if I knew that happened to one of the patients that was a part of that hospital, that part of that floor. That's a serious thing.
And I mean, I really wonder, because I'm sure you've experienced it. I've experienced so many times where a physician will come in and they'll talk to a family member, right? Like, oh, this is what's happening with your mom, or this is what's happening with such and such. This is the best plan, and this is why it's the best plan. And even though it sounds like black and white to you and I, like, okay, this is why, the general population that has no medical background, it doesn't sink in the same way. So I can only imagine that these parents who have had no one else related to them suffer through cancer, gone through being nauseated, vomiting, having central lines placed, having their kid just dwindling down in front of them, even though it may have been a good thing to put the kid in remission. All they see is their child is getting sicker.
Exactly.
And
exactly.
How do you believe when you see a baby that you created suffering so much that this is the best plan? So I'm just very curious as to, was there a hole between the communication from physicians and nurses to the family? Like, should they have found a better way for them to be more receptive, to understand?
Yeah. And like, for all those people listening, I want to remind you guys that, like, we obviously don't know every detail for this entire story and stuff, right? But we're just going off what we know. And you're right. So the kid was 4 years old. So this is a new baby. This is like a baby, you guys, right? So
handsome little kid too.
Could you imagine your baby going through all of this pain, all of this suffering, right? And you decide, I don't want my kid to go through that. I want to try something else. Maybe it is unconventional. Maybe it is against medical advice, but you still get to make that decision, right? You still get to make that decision.
And how often do how often do patients find out AMA, against medical advice?
Oh yeah, all day, every day.
We literally have those papers sitting on every floor inside a hospital. When you said, no, this isn't what I think is good for me, I'm just going to go to the house. Deuces.
Right.
Like, what dotted line do you need me to sign on?
Exactly. No. And that's, you're right. I don't know, man. I feel so bad for that. I feel bad for those parents. Specifically, do you know if they're going to be facing any jail time? Like, is there any repercussions, or do you think, did you not get that far? Because I feel kidnapping is a legitimate crime if they are, like, saying that that's what they did.
So they just went to court the other day because they were trying to get their kid back. they wanted custody because right now they're allowed to go to Noah is the child's name. They're allowed to go to Noah's like any type of hospital stuff that he has. He just had blood drawn the other day to check his markers and stuff. And they're allowed to go, but they have like a mediator, a supervisor that has to go with them
Jesus
too.
Lord.
But they said, let's see, that Noah will remain in the custody of his grandparents. The state of Florida will have the option to give them custody back in the future. So they didn't go through with that. And I don't think that they're facing
any jail time.
Correct.
Okay. But it's the grandparents that, so they gave the custody to the grandparents, assuming that the grandparents had, okay, we're going to let this kid go through the chemotherapy.
Yeah. And
wow.
The one thing that the judge really, Judge Palermo is the guy's name. I think the main thing that they really focused on was that the kid had a PICC line. And so for anyone that doesn't know, it looks like, it's like an IV that goes around your arm, around the crease in your arm, and it goes into the heart is where the tip is. But it looks like a regular IV. Yeah. And when the kids took him away, they removed the PICC line from him. She said she watched something on YouTube to remove it. And I mean, as healthcare providers, you know, it's like, oh, no, not a good call. But if you don't know exactly where it lies, you know what I'm saying? Like, it looks like a regular IV.
Listen, Jamie, let's break this down. Get the fuck out of here. All right, look, listen. Oh, I'm sorry. Am I allowed to? I'm sorry.
Yeah.
Okay, I'm just saying, that's BS. Okay, I've walked into so many dementia patients' rooms where their PICC line is wrapped around their neck. Look at my new necklace.
Yeah.
There's stop. That cannot be that's not a reason. That is a BS reason. If that's the reason they came up with, they are pulling at strings.
Yeah.
These parents deserve the right to control what their kid does. I don't know what Florida, you need to, I don't know. This is a crazy story, Jamie. Stop
I know.
it. That's not a reason. That is a PICC line is not, removing a PICC line by itself is not a reason. Okay. Yes, it is high risk for infection because it does go straight to the heart, but that's a BS reason. We both know that. Everybody knows that if you work in healthcare, those PICC lines are midlines. If the patient's confused, if a family member tugs at it, if they have an accident where it gets caught onto the bedboard or whatever, it happens all the time. It's not the end of the day, right? If they were infusing stuff that they found like CBD oil, something on Amazon, that's something I'd be like, whoa, right?
Yeah.
But to just remove it?
Nope, that wasn't it.
Get out of here. Get out of here. Stop it. Stop.
Yeah. So the judge, I think, is what they're quoting on this article that said Blandball, which is the mother's last name, testified that she had no training on how to remove the PICC line. She explained during the trial that she was still comfortable removing it because she watched a YouTube video on how to do it. Judge Palermo said in court she simply pulled the PICC line out of her son's body. And because of that, he is recommending that both of the parents seek mental health evaluations. And like you said, that would have been a good thing to do prior to taking their child away.
Right?
But not, I mean, you can't.
That's not, No, that's not a reason. Jamie, that's not a reason.
Yeah.
But look, listen. To the listeners out there, understand what I'm saying. I'm saying that the parents have that final decision. If it was up to me, if Noah was my kid, you better believe that Noah would be getting chemotherapy. I'm not saying that it's right for the parents to not do the treatment. I'm saying it is the right of the parents to make the decision. So, obviously, I want Noah to get all of the medical treatment based on evidence-based practice, but I'm saying that it comes down to the parents' decision. We, as healthcare providers, don't get to do that, don't get to make those decisions. That is why you sign a Bill of Rights when you come into the hospital. That is the parents' decision or the guardian's decision, unless the kid is 18 or older, because then it's their decision. But that's it. I mean, that's where the line ends. It ends where the guardian, the parent, or the patient themselves makes that decision.
Agreed. Couldn't have said it better myself.
I'm sorry. These things really bother, especially these ethical issues, right? Because, yes, you can feel some type of way. You can honestly believe this is not the right thing to do for my patient. You can plead and beg with the patient or the parent or the family to do things to, choose the advice from the doctor, from the therapist, from whoever. But if they say no, you have to accept it because it's not your kid, it's not your patient, and it's not your body. Those people get to make those own decisions.
And we face it so often. I remember on one of my many, many travel assignments, and definitely not going to say where, but on
Yeah.
one of these, it was I worked at several nationally ranked hospitals, but like it was one that was one of the tops. And we literally had a patient who had like a cranny. So they took like part of the patient's skull off and then they end up putting it back on and stuff. The patient was so sick, but surviving on like ventilation, mechanical ventilation. We also had stuff infusing to keep the blood pressure up, to keep the heart beating. This person started just coming apart at the seams, like on the head, around the peg tube, and the family just would not let this patient go. And I mean, there was nothing we could do. Our hands were tied. And here's this person in bed who will never open their eyes again, who will never, like, suffering. And on a neuro floor, we're having to go in to do neuro assessment. So we're having to cause so much pain to see if we can get a flicker of motion every 2 hours.
Yeah, that's
like,
rough.
what kind of torture do we have to do? But the family got to decide, like, no, I want her to hang around as long as we can until and try everything as much as you can.
Jamie, that's such a good example because literally if you flip the situations, right? If you flip the situations from a family member or a parent or a patient that decides instead of like if a patient says, I don't want to do any more treatment, I'm going to go try something homeopathic, everyone starts to freak out. But when it's family members that are like, to a patient that everyone in the medical field agree is going to die in a matter of days, and that family decides, I want the patient ventilated with all the tubes, and you guys need to do CPR every time they go under, no one bats an eye. We all agree and say yes. We all say, yep, I'm on board. I'll do it even if I think we don't have to. But why aren't we all on board when the family member or the patient decides the opposite, decides, I just want to try something else, or I just want to give up. I don't even want to call it give up, but I want to go in the way I want to go.
Right. Yeah.
And I think as the healthcare profession, even us who are in healthcare need to come to terms with that. Not everyone's going to make the correct decision according to
not every doctor is going to make the correct decision.
Exactly.
I mean, that's why people seek second opinions and third opinions and 50 opinions.
All day, every day.
Because we're all human. We all have different ideas of what is good, what is right, what is just, what is best. Yeah. And who knows which one of us are going to have the best decision.
Yeah.
To the best knowledge.
To the parents of Noah, like I stand with you. I mean, I stand with you 100%. Like I said, I don't know all the details, but from what I know so far, I'm definitely with the parents of Noah. You guys should have all the decisions. Jamie, if I was in that situation, I'd be the worst patient family member in the history. Like if you told, all right, I'm done. I know we beat this one down. All right. But Jamie, I'm sorry. I know we just jumped on into like the conversation. Do you even have an intro to the show, or is that preset and done?
Oh, no, I'll make something. I just like throw crap together all the time.
Okay. And before you could add this, not add this, but before we even like continue, I was listening to your podcast. I love the what's it called? Old Wives' Tales. Oh God, I was like guessing at every single one of them. So the one you most recently did, maybe the one I most recently listened to about the sleeping, right? Yeah. The counting sheep and the drinking milk and all this stuff. I was like wrong on like, I'm a nurse. How do I not know these things?
I'm so glad to hear that because I just did it as like while I was transitioning jobs. Like, man, I need something easy that I can record, something easy that I can do that doesn't require a lot of homework on my part. But they were so much fun to do. I'm telling
you, no. I don't know if you plan on just going full on back to like the regular episodes, which are fantastic. But it is like listening to a podcast. The podcast is very much just like stuff coming to you. Yeah. And that's one of the very few podcasts where I feel like I'm engaging with the podcast.
Great.
Right? So I was like, yo. So yeah. I'm very. I love your Old Wives' Tales. Maybe
I'll have to keep doing it.
No.
Maybe I will.
Yeah, maybe once a week, once a month, something. Don't stop, girl. Don't stop. Don't stop. I like them.
Thank you.
Of course.
Johnson & Johnson had to pay $572 million.
Yeah. So I actually, so for those who are listening who don't know me, I'm Q, and I go by Q the Nurse, and you can find me everywhere, anywhere by Q the Nurse. But I do nursing news every week. I do nursing news. I do stories that matter to nurses and healthcare providers. And I did a story on this, right? And this story made me very happy, Jamie. This story made me so happy because I'm gonna get on my soapbox for a hot second here. All right, look, listen to me. If you go to a state where marijuana is legal and you find a kid in the corner smoking a blunt, you could put that kid, that young man away, that young lady away for years, literally years, for smoking a blunt. And we all know the worst thing that happens to someone that's on weed, if they're not driving while on a DUIs, driving under the influence in any kind of drug, I'm all against. But if someone is just smoking weed, doing that by themselves, the worst thing that can happen to that kid, maybe they get the giggles, maybe they order some McDonald's late at night, all right? But to have these humongous corporations pump this entire country with these insane amount of opioids and narcotics to the point where people are going on the street to buy heroin, jumping to needles, using fentanyl, dying at rates we have never seen since the crack epidemic, right?
Mm-hmm.
And then these huge corporations, not only do they walk away free, but they're making millions and in some cases billions of dollars a year. And they've been scot-free. Nothing's gone wrong to them. No one's getting charged. No one's going to jail. So the fact that Johnson & Johnson had to pay that $527 million, I was like, this is the beginning of I was just so happy to hear this news. I don't even know how you feel about this, but I do know this made me so happy. And for those out there who don't know, because I did do the story on this, Johnson & Johnson made, I think it was like 18 or some crazy number, billions of dollars in 2018. So $527 million does sound like a lot, but it wasn't it didn't break the bank. They're not bankrupt. They're not losing their business. All I know is this is the beginning of something special. I'm happy that they had to pay that fine.
Well, and I mean, if you look back through the history of the very beginning, before the epidemic really became in full force, there were multiple waves or stages of this.
Yes.
And it all began because these med reps went around and they had these medications, talked to physicians about these medications and said, hey, you know what? Let's not just do these narcotics for your cancer patients, because those are the ones who typically got opioids, right?
Yes.
And they said, hey, but these are non-addicting. We've done studies that have proven that these are non-addictive medications. And so physicians started prescribing them because they wanted their patients to be as close to pain-free as possible, right? So oh, I had rotator cuff surgery. Here, take tons of this. Oh, you broke your foot really bad. Take tons of this. And then that's where it all began.
Yeah.
And the upward of 80 some odd % of heroin addicts, it all happened because they first had a prescription to opioids.
Yeah. And
they're not just bad people who decided to go out and they dreamed of being a drug addict one day. That's not where this came from. So I mean, whose problem is it that we got these people addicted?
Exactly. So, and that's why you have to go back to the source, right? And I think it's a good thing, right? Because I think for the most part, people start to understand. And the reason I say people are starting to understand this is because a lot of the times now when I'm at work, I'm giving painkillers to patients and patients are like, oh my goodness, am I going to get addicted?
Yeah.
So I understand when patients are actually worried, and it makes me happy because at least they know what can happen. These addictions to these drugs isn't going to happen to everybody. Yes, it can happen to you. And I know we always say it could happen to you on your first dose and all of these crazy, scary things, but that's because we want to prevent it from happening. But it's not going to happen to the majority of patients that they take the medication, the prescription as of 2019, at least in very specific hospitals. Some places in the U.S. still to this day are handing out opioids like it's candy. But I'll go there in a second. But what I'm saying is I'm happy that patients are now understanding that this is a thing that can happen based on the medication that they get prescribed from the hospital. And like you said, Jamie, it started from these what was the term you used? These med reps that went to these doctors. And a lot of these places, a lot of these med reps, a lot of these pharmaceutical companies would tell these doctors, if you prescribe this opioid, we can give you a bonus, especially to these primary care physicians. If you prescribe this, and then these doctors are like, yeah, so they say it's not addictive. It is a painkiller. It is helping the patient, and I'm going to get paid more. It's a win-win-win-win, right?
Mm-hmm.
So these doctors started handing them out like candy, and next thing you know, when that prescription runs out and the doctor says, I'm not going to give you any more prescription because your diagnosis doesn't call for it or your situation doesn't call for it, they're going to find that fix somewhere else. And that fix is going to be some street drug, and that only street drug that can compare to the strength in which they got that med is going to be heroin, is going to be fentanyl, it's going to be some hardcore, nasty, nasty, crazy shit that is shipped from all over the place. I don't want to get into the whole drugs are coming up from Mexico craziness because but that is the next step that they're going to go into. And when they do get into those crazy places, I don't know, like, I don't know if people know, but the fentanyl that is now laced in the heroin that people are getting, the fentanyl that they now placing into these drugs that are from the street, like the smallest doses of this fentanyl, the smallest doses of it can end your life.
Right, because it's not the same type of fentanyl that we give patients either.
Exactly.
And I think that's another confusing thing because, okay, so neuro, my history. So with our patients, we don't like to give anything that would cause them, I mean, you have your brain cut into and they need something for pain, right? But we can't give anything like Dilaudid that's going to cause them not to be able to wake up easy.
Exactly.
Because we're going to think, oh my goodness, maybe they threw a clot or maybe they're bleeding. But we give them fentanyl. We'll give them like 25 mics of fentanyl or so. But that is not the same as the fentanyl that they have now. The fentanyl that's on the street is actually synthetic. It's non-medical grade fentanyl. And that's why it is so dangerous. Because it's not made properly, but it gets the quote unquote job done, for what they need. But that's
and that potency is through the roof. The potency is through the roof. I mean, like I just got my CPR renewed, right? And like, so I've done CPR. I've been a nurse for 3 years. I've been a nursing assistant before I was a nurse, I was a nursing assistant for like 3 years prior to becoming a nurse. And I've done CPR every 2 years since, right?
Mm-hmm.
And never before in a CPR class did we have an entire section on Narcan. Never before in a CPR class did we have an entire lecture on what do you do in patients when you find someone on the floor. So the EMT, the medic that was leading the CPR class is like at this point, and I'm talking about Connecticut and Massachusetts. We're not even talking about the other states that the deaths of heroin is skyrocketing.
Like
right?
Philly, West Virginia?
Exactly. But in Connecticut and Massachusetts, they are saying when they find someone out cold, yes, they are obviously thinking cardiac CPR, let me jump on it. But they are giving literally every patient that they find Narcan, the nasal spray. Literally every single person. If it doesn't work, great. So this is a cardiac issue. This is they had a cardiac arrest, but they said like 50% of the time so yes, they are those drug addicts. When you picture in your mind someone who's like doing heroin, they are those drug addicts. But you have to remember, it all starts from the drugs that the doctors prescribe. So you also do have the grandma who had the hip surgery. She goes home. She has hip pain. She takes a pill. She takes another pill. She forgets that she took those 2 pills. An hour later, she takes 2 more. And next thing you know, she's out cold, right? You have those kids that the parents are super worried about their kid. They in chemo. They have these crazy diagnoses, and their parents give them extra medication because they just want the kid not to be in pain. Next thing you know, that they're out cold, or that kid is 8, 9, 10 years old, scrummaging through mom and dad's closet or medication drawer and taking some some of these narcotics, and they end up. So it's literally everyone. Yes, they are those hardcore patients that end up wanting to switch from the prescribed dosage of Dilaudid or fentanyl or whatever they got at the oxys, and they want to jump to the heroin. But that also trickles out to the family, to the community in ways you don't expect, but it is affecting literally everybody.
I started volunteering, which a lot of my family completely disagrees with. It's been interesting over probably since 2012. I think I've become more of my own person for like what I think is right. And I think it's really because of the exposure to the people that I deal with in the hospital setting, right? I'm from the South, so I'm from a very conservative area, from a very Southern family, but I've had so many patients here, especially in Raleigh, that they suffer from heroin addiction. We have a lot of overdoses that are there, and you hear so much negativity, like, oh, we just need to let them weed themselves out. Like, we need to stop doing this. And it is absolutely horrible and horrendous. So I got so tired of it, I started volunteering at the North Carolina Harm Reduction Center. And like, we spent 2 or 3 hours the other weekend just stuffing bags full of Narcan and like syringes. So they take a van out into the communities that they know that people are shooting up with heroin or that people are doing whatever, and they hand them these bags like, here, call this, it's Good Samaritan. Like, we also need to know like what you took so that we can warn the other people that this is a dangerous batch. And so many people are angry at those of us who go out and we do things so that they can have Narcan, so that they can save their friends, so that they can live another day and maybe get help tomorrow, you know?
So Jamie, that's a super touchy subject. So like,
I'm all full of touchy subjects. I'm such a controversial person.
And I love it. And I love that you brought that up, because this is something that I do struggle with a lot, because I agree with you 100%. I'm like super in that, like, I'm definitely on your side, maybe even more so, because I do believe that we should have like safe drug use, what's it called?
Facilities, safe injection facilities.
Exactly,
yeah,
safe injection facilities where you should get clean needles, where you know that there's going to be some healthcare professionals there, where we have Narcan on like there's Narcan there if anything were to go off the
and resources to give you access to rehab too, so you don't have to find that out on your own.
I knew there was something here, Jamie. I knew there was something here. But at the same time, I can definitely see how the public, and not even just the public, just other people, like other healthcare providers, I can definitely see how people would view that as the worst kind of enabling, right? Like, I understand how that is. It looks bad, but if you give a safe place for people to do these things that they feel that they need to do, or a safe place for people to do these things that they are going to do no matter what, right? It's an addiction, meaning that they are going to go to any length to get what they need done to them. So they will go out to the street and use a dirty needle that they find on the floor. They will go find someone that is selling some crazy laced fentanyl heroin that they have no idea, and inject it into their bodies because they think that it's what they usually get. If you give them a safe place to do this, if you give them the right dose, if you wean them off right, if you have all the resources, at least we have it documented. At least we have help. At least we have a community around them that can pull them out of that hole.
And maybe these people need to feel loved. You know, maybe they need to feel supported. Maybe they need to be seen as a human being. I mean, I truly think that we all have the ability to be addicted to something. I think that some of us are addicted to work. I think that some of us have an addiction to shopping or alcohol or, I don't know, sex. Like, we all have things that we're really drawn to and we just can't get enough of. And it makes me sad and it hurts my heart that our society, like, those are the people that we look down on, and I feel like we want them to be the bottom of the barrel because it makes us feel better about It gives us a hierarchy. Well, at least I don't suffer from that. At least I'm not a drug addict. I may not have a dollar to my name because I can't save money because I need to be out buying clothes or buying the newest whatever, but at least I'm not that person, you know?
Yeah. No, and that's a really good point because, yeah, I mean, like, you're right. Everyone can be addicted to anything, and everyone has a different, I don't know what's the, like, some people, like, a little bit of stress is going to cause them to jump overboard. Some people, a lot of bit of stress is what they need for them to, jump overboard. But
we're all individuals.
We're all individuals, and some addictions hurt us physically. Some addictions hurt us financially. Some addictions hurt us emotionally, right?
Mm-hmm.
If you're addicted to sex and you're having sex with all these people, yeah, you can get these STDs, but you also can't never have a wife, a partner, a husband, whatever, right? So there's all these crazy addictions that people can have, would have, are more inclined or less inclined of having. So if you have that community that just says, look, we're human beings. We're here to take care of each other, right? Like, this is a safe place for you to take care of the things that you feel like you need to take care of, but we're going to help you get out of it. That has to be the answer, because what else can we do?
I know. And unfortunately, a lot of medical providers, they look at addiction very differently than what we're talking about as well.
Yes.
And I 100% of the time always stand up for the addict. I don't care. I'll go toe to toe with a doctor any time of day to say, no, this is not okay. This is not what we're going to do. Your plan sucks and I don't support it. And this is what would be better. But then I also think too, these people, like, we don't know what they've gone through in life and need to be numb towards. Some of us don't have healthy coping mechanisms. Like you were talking about the levels of stress. Like, you don't know if this person wasn't sexually assaulted by their dad until they were 18, and they can't escape those nightmares. And every day that they open their eyes, like, it's just so heavy in their soul. And, like, why are we so mad at these people that they need an escape from reality? Like, why can't we be there to hold their hand, to love them, to say, hey, I'm with you through it all. Like, if you slip and fall, I'm going to be there to pick you up 101 times, Like, we just don't stop and think about all I know is what I deal with in the stress of my life. And I've had a very blessed and golden life, but my life isn't everybody else's. And I can recognize that. And I think we really, society in general, healthcare professionals, non-healthcare, we all just have to look around and see that we're human and people suffer differently.
No, and you're so right, because, like, I ditto. Like, my life has been I can't complain in comparison, right? I think I've lived like a legit blessed life.
Mm-hmm.
But even the little things that cause me to struggle with if I, I'll go, weeks at a time. I'll go to the gym and I'll binge eat and I'll be disgusting. And we all go through these little things where, right? Like, or you just being a bum and just Netflix and chill for literally an entire week and not getting out of your bed and being just a legit bum. Like that, you could just think about, oh my goodness, I'm stressing out about a car payment, where someone else is stressing out because their family's sick. Or like you just said, they've gone through sexual assault and abuse chronically for years of their life from someone that they supposedly supposed to love them, like a parent, like an uncle, so it is, you have to at least. And that's why I think nursing is the greatest profession in the world, because you are forced to empathize with the patient in the bed. You are forced to ask the question, why did they do the things that they did that caused them to lead here? And then you have to understand, because of those situations, they are here, and we're going to help them get out of those situations. So, if you are not willing to just put yourself in someone else's shoes, it's going to be really hard for you to accept that, yes, we do need these safe places for patients to come by. But I have to ask, Jami, are you willing, or do you think it is, like, when it comes to marijuana, I think marijuana is an easy one. Like, do you think that it should be legal federally? And then on top of that, do you think we should do other drugs that should be legal recreationally? Or are you like, no, thank you for the legalization of other drugs, and you think we just should have safe havens for people to use them?
I think marijuana, I definitely believe should be a legal thing.
You said illegal or illegal?
A.
Oh,
The
okay.
letter A. Legal.
Okay.
I mean, because honestly, if you look, because the FDA has marijuana in the same schedule or class as heroin, they can't do enough research on it to really see what all it helps. So when people use it, quote unquote, like inappropriately, and then they found, hey, my mom had lupus, and actually she's doing so much better with the use of this, or like with CBD with kids with epilepsy, like it's an off-label use. I think there are a lot of things that it actually could help, and I think that it's a lot safer than alcohol. So I don't know why that would be illegal. Honestly, I think that just not enough people understand, or you have like older people that was never the way it was, so they want to keep it that way. I don't know if all drugs should be legal. Like heroin's a tough one.
That's a real tough one.
Yeah.
That's a tough one.
I don't think that you should be able to walk down or walk into a store and buy heroin, but then again, it'd probably be a lot safer than the stuff that's laced with synthetic fentanyl.
It's hard. It really is a hard question, and I hate to put you on the spot like that, but
no, I love it.
That's the kind of thing I struggle with, because I'm like, how far is far enough, right? Like how far are we going to go? Like I do want it to be safe. I do want it to be regulated, and it would be nice if on the census it would be like, do you recreationally use heroin? And then we would have a number of people. We would have like actual data to back these things up. Mm-hmm. But I think this is like. And like this is another topic that you had, so I think maybe we can jump on that.
Yeah.
But like, this is the same thing that's happening with all of these people with this crazy lung disease from the vaping.
Yeah.
It's because like there is no research. We have no, Jamie, we have no idea what's causing it. We have no idea why it's happening, because we were never allowed to research using marijuana. And now that it just started, everyone's just researching like the purest form of using THC, and no one has even questioned or asked the question, what happens if you smoke it via vape? What happens if you take it via an edible? Like we don't know these things because it's been just outlawed because it's been a Schedule I drug. Right. So now that in very few states it's been legal, we can start asking patients, and patients aren't afraid to tell us things like, yeah, I do use marijuana recreationally, so we can start adding things up and saying, all right, there's a trend here with patients who vape who are getting this crazy lung disease. Maybe we should not make this legal to sell, or we should tell people not to use.
Which can I also say on that matter, like I understand wanting to make it illegal because of the safety or whatever. Like I get where they're coming from, but dude, you can still smoke cigarettes. Like how many people have died of lung cancer that smoked, and they're still legal? You just warn them of it. Like,
right?
So you're gonna outlaw vaping? Seriously? Get out of here. I read that and I was like, this is so dumb. Like there's so many things that I mean, what about meat?
Exactly.
I mean, how much steroids and all of these things that are pumped into cows and in milk, but we still allow people to drink milk.
Don't get
and people are dying of cancer that could be associated with that. Stop.
I was a vegan for about 1.5 years because after watching What is Health or something, it was a Netflix. What the Health on Netflix. I was like, oh, forget about this. And you're right. I mean, like after they tell you how many antibiotics are pumped into these cows, I was like, oh my God. I mean, it's insane, right? So yeah, just like you said, people use eating sugar 24/7. People consider like sugar is like they have been legitimate studies that have shown that rats and human beings alike react to the addiction of sugar the same way that they react to the addiction of heroin. But no one questions. We can't. If you were to go to a group of people and say that sugar is a drug and we should make it illegal, the entire room, the entire world would be like, you're insane, right? You're insane. But for marijuana, like really, you guys, people are going crazy. And I don't know what the money influence is because the marijuana companies, businesses are just up and coming. They're startups. Yes, they're blowing up in the very few states that it is legal, but they don't have the same backing of these humongous international corporations that are pharmaceutical companies. So it might be easier to just be like, vaping is causing these crazy lung diseases, so let's just outlaw vaping. But here in Massachusetts, there is literally a ban. It is legal to smoke marijuana recreationally, but you can't. They stopped it, like, I think a week ago, that you are not allowed to buy any vaping products with marijuana in it. Like, it's hardcore.
Yeah.
And it's kind of crazy to see that they're moving this fast. And there's been, like, I think, like 17 deaths. I'm not saying 17 is not a big number, but 17 compared to everyone that's died of heart disease.
Cute. Cute. Let me tell you. So I posted on Twitter. Now, again, the way that I see the world is you do whatever works for you as long as it doesn't harm anyone else. Like, if it makes you happy and it may hurt you, as long as that doesn't move into anyone else, you do you, right? Like, yes. I don't agree that somebody should be out selling drugs to a 10-year-old, but like, if you want to do cocaine and that's what you need for your life, that's not for me to judge. It's not for me to interfere with. I was born, I get to live my life. But anyways, when they posted that, like, at the time, I think there were 6 deaths reported whenever I first did this. And it was like, they're outlawing vaping because 6 deaths have been reporting because of yada yada. And I was like, I retweeted it with the quote, wait till the government finds out how many deaths have been caused by guns. Like, I mean, seriously.
Right? No, it is actually legitimately crazy. It's legitimately, I mean, I don't know, man.
Like, I mean, I don't care if people have guns. Like, that's, I could care less about that. I'm not like, no guns should be allowed on whatever. But, like, you're freaking out about this, but there are mass shootings all the time that people are dying and getting injured from.
No, you're right.
So let's take away the jewel.
No, I'm telling you, no, because I'm saying I'm hardcore. Jamie, I think we would get along because I'm hardcore. I'm hardcore on your side, but I am a little more activistically like oriented with the gun violence situation. I really do believe that they should be a buyback program, that we should be getting all these automatic guns off the streets. But like, yes, you are 1,000% right. Please don't give me, I don't want a lecture. I don't want any laws. I don't want anything about these vapings, these jewels. If we are going to allow you, like, if you go to a Walmart and buy a semi-automatic weapon from a goddamn Walmart, don't tell me nothing about a jewel or a vape. Get out of here. I don't want to hear anything from you. No, thank you. No, thank you.
But again, that also goes back to what we were saying earlier, because like way back earlier, you're talking about putting limitations on something that will only injure you, right? So like, let's not do a jewel. Let's make it illegal that you can buy these vaping products that you will only injure yourself by buying this, right? The harm is only on the individual. Whereas we're not going to restrict gun laws because like these white old men are going to be very angry about it. But like, how many other people are getting hurt because of the gun that one person buys? Like these mass shootings, like I don't see these large numbers of people who got like secondhand vaping smoke or whatever,
right?
You know?
It's crazy. No, I love the way you look at that, right? Like, because I think that is, Jamie, that is genius, right? Because that is how we should look at freedom. If something is only affecting the individual, do you boo, right? Do you, like, I can give you all the information in the world, but if it's only affecting you, I should have no right to say, do it, don't do it, you have to do it, you can't do it, whatever, right? But the minute it starts to affect the people around you, anyone around you, that's when we can start putting laws and regulations behind it. I love that perspective of life. I think that's genius, Jamie. That's genius.
I saw a bumper sticker one time. Again, live in the South, so they, a lot of Southern places, they hate gay people. But I saw it was like, don't agree with gay marriage. And right underneath it said, then don't have one. And I thought that was the most profound thought, that if we all adopted that mentality, the world would be a beautiful place. Like, if it doesn't work for you, then don't do it. Yeah. And otherwise, let other people do what does work for them, you know?
Exactly.
Same with abortion, same with whatever. Like, if you don't agree with it, don't take part. It's really that simple. It really is.
Live and let live.
Yeah.
First of all, I do hear, I think is it a dog?
I know. She just started going crazy. My little dog, Ellie.
Wait, what's her name?
Ellie Minka.
Ellie Minka.
Yeah. So, Minka from Alabama's team.
Yes. Of course.
And Ellie is from Wayne Ellington, who used to play for UNC. So that's where she got her first name.
Are you serious?
Yeah. Mm-hmm.
Good for you. My God, you really you're deep. You're deep. Do you watch like national football? Like
I don't watch
professional?
NFL.
Oh, okay. It's just college. You're big on college.
I used to follow it until Scam Newton got drafted to the Panthers in 2011, and I was like, done. I just can't be a part of this because it doesn't fit my life. I couldn't be angry every week, it wasn't worth it to me.
Well, good for you. I love when people have these irrational standards, right? I love it.
I'm allowed one. There it is.
No. I legitimately appreciate that in a person, as long as they know it's irrational. But,
yeah.
But what I wanted to say, I don't know. So like, I have to ask, and I know that this is a biased perspective from someone up north, and like I live in Boston, and I'm surrounded by these hippie, oh my goodness, we should be living in a kumbaya, and like I can't get to that level of like hugs and kisses bullshit, but like I want, like, how, like, have you always been against the grain living down south, like with the conservative religious family, or has it been something that like your entire family has been way far on the left compared to everybody else?
Man,
like, is this something?
I really appreciate that question. This is, by the way, this little Ellie.
She's beautiful. How old is she? Is she just tiny, or is she a puppy?
Oh no, this is her size for all of her life. She's about 4 pounds. Yeah.
Oh my goodness. Hello, Ellie.
Hello, Ellie.
Ellie Minka.
But I really appreciate you asking. No, my family is very, very conservative. Actually, one of my future podcasts is, and I would love if you would want to talk about this, because this was going to be my next podcast, and I did a lot of research on it. But like one of my future ones is going to be on the Confederate flag or the rebel flag. Oh, and because I live in a very Southern family.
I'm going to let you finish, but Jamie, I'm in. I don't care when, where,
You're
how.
You're my hero. I love you. Like right now, we're doing it. If you have like 30 more minutes, we're going to do it. But yeah, no, I have definitely not fallen in line with my family. I was married for 7 years, and then I got a divorce, and I started dating this guy, and we flew out to California, like LA. And while we were out there, I saw this person, like real crazy looking, walking down the street. And I was like, oh my gosh. So like I hit the guy I'm with. I'm like, hey, Eric, look at that dude. And he's like, okay. And then as I looked around, no one else paid attention to him either. And I thought, people actually stay in their lane and they don't care that this person looks weird, or that they have like a green mohawk, or I didn't know the world was so big, and I really think it was from that period. It's been years of progression to get away from the mentality of the South. Like, I hate that I live here. This is not my forever home. It's not part of me, but I want to make a difference, which is the whole purpose of this podcast. If people just stop and think and understand, then maybe we can respect and love. Like, you don't have to agree with it, but maybe you can understand a little bit more, not to hate the person,
God damn it. You're gonna get me tear up, you girl. I'm like, that's so deep, Jamie, just because it's so easy for me to point the finger, and I feel like and I always say this out loud. I always say that, yes, I'm a progressive, but I know that there's a bubble that I live in. I know that there's perspectives I have that aren't I don't want to say universal or just that's a part of what like my bias, and I'm always asking myself where that bubble is inappropriate or not right or just unfair, right?
Mm-hmm.
And the fact that you noticed it, you
Oh, yeah.
acknowledged it, and you've worked to fix it. I mean, that's the goal. I mean, that is the ultimate goal, and I feel like, Jami, good for you, girl. Oh my God.
My dad, he's a really great man. But he flew out. I had a contract in Phoenix last summer, not this past one, but of last year. And I remember, and I was talking to him, and he's like, I think I'm racist, and I really don't want to be. And I was like, okay, why do you? Again, very Southern family, right? Like, and I was like, why do you feel like you're racist? Because he knows that I'm very much against that, and very, very much against it. And so I was like, why do you feel this way? And he's like, well, I would never date a black woman. And I was like, okay. And I was like, I mean, I probably wouldn't date someone who had brown hair. That's called a preference. Like, you're just not attracted to. That's not racism. And I was
that's
like,
very different. Yeah.
Do you feel like there's other ethnicities that aren't as intelligent as you? And he's like, oh no. And he's like, this person's so much more brilliant than I am. And this person, and this person was Mexican and this person was black. And I was like, okay, do you feel like you deserve more than different ethnicities? Like, I don't know, if you have like an immigrant that comes over, do you believe that you deserve something different? And he's like, no, if they work hard and they do it the right way to get in the country, no, they deserve the dream too. I was like, Daddy, that's not racism. But even it broke my heart in a sense too, to think he's lived all of this life to think that he was closed-minded, because he never really understood what that meant either. And I've seen him interact with people that weren't white. But it doesn't. But there is so much of it. I mean, there's so much legit. I mean, even from like Muslims or, after 9/11, like people just can't comprehend that it's okay to be different,
And that's such a good point, because I feel like it's super easy. It's really easy to point out someone that is conservative or likes tradition quite a bit and say, yeah, your tradition, your conservatism is causing you to believe in old school thinking, right? But I think the problem with the left is causing that exact problem. It's making everyone believe that they're racist, making everyone believe that they're sexist, making everyone believe that they're Islamophobic, that they're transphobic. You have to let people know, look, listen, just because you don't understand something, you might just be ignorant. You might just not freaking know.
None of us are going to know everything. But I mean, you can take the time, but you also don't have to put down what you don't know. I mean, I think that we fear, like we hate the things that we're afraid of.
Yes.
And so I think that when we, again, here's the purpose of the podcast, like you hate what you don't know. And so if you take the time to educate people on topics, then maybe they won't hate it so much anymore. They won't hate this person or this group of people.
No, I mean, that's exactly right. That's exactly right. And I think and look, listen, for the vast majority of like history of human beings, right? So women have been put down, people of different races have been put down, people of different sexual orientations have been put down, right? So I'm okay that now we're in this super hyper cancel culture where everyone's walking on eggshells. Like, I get it. I get the fact that you don't want to be walking on eggshells, right? But I'd almost rather this for a little bit. I understand that we need to get over the hump, but for a little bit, I'm okay with people walking on eggshells, trying not to offend anyone. Because I would love to live in a world where the goal is not to offend people. But at the end of the day, we have to let people live. Because if we're walking on way too many eggshells, it gets to the point where we are afraid to talk to someone different because we are afraid to offend them. And I don't want to live in a world where you're so afraid to offend other people that you don't even interact with them. Because then what's the point, right? Then what's the point? So we need to get over this hump of, I'm afraid to offend you. But the left needs to calm down and understand some things that are offensive, some things that can cause microaggressions, and all of these things are done or happen because of ignorance, because of I don't don't know that that's a problem. So just let me know and it won't happen again.
Yeah.
I'm not trying to offend you. I'm not trying to be a dick. I'm not racist. I'm not homophobic. I'm not sexist. I just didn't know.
Right. We have a physician at the hospital that I work at who is transitioning from a woman to a man. And, you know, as a rapid response nurse, you have to interact a lot with this physician because, like, it's an emergency, like, we need your neuro consult or whatever. And there was a group of the people that I worked with, and they were saying, it just exhausts me to have to figure out how to use the correct pronoun. Like, we're in an emergency and I'm saying she, but it's really he. And then I think that this physician is being a little sensitive because they're correcting everyone. And I was like, whoa, do you call your car she? Like, oh, I just gave her a bath and it's so pretty. And I was like, this is an inanimate object. Like, and you don't have a problem giving it a pronoun. So what is your struggle here? And I know that it's a transition for you because you've known this physician for a lot of years, but don't be offended when they correct you either, because, like, for this physician, they're getting the incorrect pronouns, and after a while you have to feel like it's not respectful. You know, like, you made this big thing. I want to go by he. I want to go by this. And when you keep getting she, even though you may have only made the mistake like 2 times, but what if everybody they come in contact with has made the mistake 2 times? You know, so it's just be aware. I agree with you that the eggshells, like, you don't want to be hypersensitive all the time, but just to have the understanding of the things that I do will affect someone else. It doesn't just affect me. This world is not just about me.
So I think so that's something that I have been really open about has been really difficult for me, right? And people lose me when they get to the place of, like, there's more than 2 genders and gender's a spectrum, and, like, I need more education on that, right? Mm-hmm. So that's something that I am, like, so I am a little, but I'm not confused about what you just said, right? And I love, because I've never heard someone put it in that way. Like, people all the time call inanimate objects he, she, this is my baby, like, all the time, and no one blinks an eye. But the second a human being that has emotions and feelings just like you asks you to just use a different pronoun, and you're gonna be offended, you are offended because they want to be
it's
called
hard
what
for
they
you.
want.
Yeah,
like that was like an easy, blew my mind. I can't understand someone being offended by someone else saying, call me, but by the way, I want to be called. Like, I just think about it as simple as, I have a really difficult name. Everyone, so, like, my name is Swadik, but everyone they called me a million different things. So when I came up with the nickname Q, and I had asked people to call me Q, when people would call me things outside of Q, I'd be like, just call me. I don't want to deal with me correcting you every single 5 seconds. So just call me Q. And that would be a frustrating thing for me. And that's a goddamn nickname.
Right?
That's not a pronoun that makes me feel like I'm a different human being. So I really could not understand anyone that is offended by someone else telling them, call me by something that makes me feel comfortable. Right. So,
and even when they're like, oh, but I knew this physician as this name, right? Like, this, I've done this for a while. This is how I met the person. And then I said, what do you call your husband when you talk to him? Babe, honey, sweetie. You probably didn't call him that the first day you met him. It was probably Joseph or Henry. Right. So, like, you replace that very easily. So why is it difficult because someone else wants it? Like, you did it because that worked for you and your relationship with your husband or your boyfriend at that time. Like, make it work for your professional relationship with this physician.
Exactly.
We do it all the time. It's just that when we're asked to do it, all of a sudden there's an issue.
Exactly. When someone gets married and they change their last name, do you freak out? Like, is that the end of the world?
Yeah.
No, it's literally just a name, and that name makes that person feel whole, feel better, feel respected. So just goddamn, you don't lose sleep. It's literally nothing. And the very few transgender people I have met in my life, they don't get pissed off at you if it's a legitimate accident. If
Sure.
they're like, I get it. Like,
Yeah.
they're not clueless to the world, right? They get it. They get it. So if it's a legitimate accident, they're like, all right, no problem. We're moving on. Just try to not do it next time. But people are losing their minds because someone is asking. Yeah. Yeah. No. It doesn't. That's something that I agree with you 1000%. And I was actually, before I got this job, the travel nursing, before I took the travel nursing job, there was at the big hospital here in the city, I was going to work on a floor that does do conversion therapy. And like, I was like, this is so nice and so cool. And like, they had like all of these things that can help like ease the process from, you know, any conversion from male to female, female to male, whatever the conversion is, that can help ease that process and teach people. And I went through that orientation and I was like, wow, this is...
You had to go through an orientation with it?
Well, it's an orientation. It was like basically an orientation for the floor. And these are like, you know how you have in the posters on like the cardiac floor, these are the signs for heart attacks. It was basically, this is the pronouns you want to use for someone going through this transition. These are the things you want to say.
Though.
Yeah. So like, it was very commonsensical, but like it was just a reminder that this is going to help that person, that person's family, that person's friends understand, right? Like, so you go, exactly. So you want to use the pronoun that they want to use, not just after the surgery.
Sure.
You want to use it the second they walk into the to the appointment, right? If it's a transition from male to female, you want to call her a she the entire time through. Not, oh, congratulations, you had the surgery yesterday, so today you're a she, yesterday you were a he. It's what they feel like, and it's like real commonsensical things, but it helped a lot, and it just...
That's awesome.
It was nice. It was just nice. It was just nice. It was nice to see.
So, talking about sensitivity and talking about how people should be aware of things they do or say, or the things that could impact someone else they interact with or come in contact with. Like I said, I've been doing a lot of research because in the South, and a lot of my family, they're very proud of their, I'm using air quotes, heritage.
Yes.
And you know, like I've had my aunt and uncle, one of them, they quit watching NFL for a while because Kaepernick took a knee. And, you know, when they did the whole thing with the Betsy Ross flag, and here the thing that people fly proudly on their clothes, on their body, on their cars is the Confederate flag or the rebel flag. And like with you being a Black man, like have you ever taken care of a patient that maybe had like that tattoo or that was a symbol? And how would that make you feel before you actually interacted with the person or the family member?
So like, I just have to say, going into this conversation, that I have very, 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 very strong feelings on this topic, right? So I'm not even going to beat around the bush and pretend that I want to understand. Okay. So to answer your question, I live in Boston, Massachusetts. There are very, 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 very few times that I have seen the Confederate flag. In general, I have never seen a Confederate flag on a person. I have seen a patient with a Nazi, what's it called?
Swastika?
A swastika, a tattoo. It wasn't like a tramp stamp, but it was on their back, lower back.
Oh my
Crazy
goodness.
tramp stamp to have. But it was a male. It was a male patient. So unless that issue comes up, I try to pretend that it's not there. It's hard. I gotta be honest. Like, it is hard to pretend that you don't see it, right? But unless that issue comes up, if the patient says, I don't want this Black patient, this Black nurse, I don't want this Asian nurse, I don't want this, Indian doctor. Like, if they ask or say any of those things, then the issue comes up. But that specific patient, that issue never came up. So I didn't push any of my judgments, and I let him believe the things he believed, and I didn't try to pull anything out because I didn't want to start anything. He's a patient. I'm here to take care of their health. Let's move on. So I'm lucky that I have never had to deal with that. But when it comes to the Confederate flag, when it comes to dealing with that kind of stuff, like if you have gone through American history, you know that the South seceded from America. They wanted to be a different country because of slave. So like it's and like if you do any research, the Civil War caused more deaths to Americans than any other war, there is no comparison, right? There is no comparison. So for you to be proud of your heritage, yes, if you were born in Germany, or if you were if your parents or your grandparents were German and they were Nazis, are you proud that you are alive? Are you happy that you are a human being? Yes. Do you fly the swastika flag every day because your parents were part of? No, because you understand that your parents, your grandparents, your ancestors have done things that are not things that you believe in today. So I don't understand why people can't take that outlook on that same situation when it comes to race, when it comes to the Confederate flag. I just think for you to proudly wave that flag around and say that this is a part of my heritage, so I am going to wave it around. If my uncle or my great-grandfather was a murderer, I'm not going to go around saying murdering people is a good thing because someone in my heritage did it. You just have to understand that I'm happy that I'm alive. I'm happy that I'm a human being. I'm happy of who I am today, but I'm going to take the best parts of my ancestors, the best parts of my grandparents, and I am going to represent that in who I am today with the best of who I am, right? So, yes, that is how I feel. I'm sorry, but yes.
No, I appreciate it. And come to find out, I've done a lot. I'm not a big history buff, but since doing this podcast, I've really been digging into a lot of different things for each episode. And come to find out, the rebel flag that they used, it was never a flag. Like, it wasn't nationally recognized. There were 3 Confederate flags. That was never one of them. It was just one that
Are you serious, Jamie?
I swear, this was like a flag that was in Tennessee that they ended up using at the very end of it, but it was never nationally recognized. So when people want to say that this is their heritage, what heritage? And the official flag of the Confederate States, of the Confederate Union, was the Betsy Ross flag.
Oh, wow.
The one that they didn't want on the Nike shoe or Brooks shoe, I think it was Nike, on the Nike shoe. That's why there was such a stink about it, but no one ever took the time to figure out, because they said, hey, it was just a flag of our country. No, it was the flag of the Confederate States.
And wait, the Betsy Ross flag, was
it's
that
the one with the circle?
With the circle of the stars, right? Yeah, okay. Yeah. Wait, Jamie, I had no idea that's insane.
Mm-hmm.
That also goes to show that when people say it's for the heritage, number one, did they really do their research? Like, if you're that one family from Tennessee that is an ascendant from the creators of the Confederate flag that we know here today, 2019, good for you and your heritage. But for literally everyone else in the South, did you do Ancestry.com? Did it say like are we going to be real here? Mm-hmm. That's insane.
Yeah, and I can't for the life of me figure out what the part of heritage that people want to hold on to. Like, you lost. At some point, like, what are you proud of? I mean, I don't understand how that feels because I'm an Alabama fan. But you don't have the potential to be successful again. Like, they literally changed the Constitution because this was no longer a part or relevant or okay. And part of the reason why they succeeded, that I also found out, like you were saying, because they weren't okay that they didn't want slaves anymore. They also, under the federal law, they didn't want people to lynch Black people anymore. But the South still wanted to do it. Like, why is that something you want to be proud of? Why do you want to be proud of a time that you caused pain and death? And did you know that there were 4 million slaves that were set free after the North won?
That's
4 million.
Insane.
Do you know how long ago that was for there to be 4 million slaves?
That's crazy.
My mind is blown at that number alone.
4 million is a big, 4 million is a big number. And you're right. I mean, at the end of the day, that was the cause of the war. Because slavery made a lot of money, and they were not willing to let go of that free labor, and
Right,
that free labor allowed them to make all the money that they did make down south. But yeah, that's the reason that this seceded. For anyone who says that they were fighting for state rights, they wanted the state rights to allow slavery.
Yeah.
That's why they wanted those states' rights. So it's, for me, it's a closed and shut case. If you are waving a Confederate flag, I just have to say that's one of those things where I'd rather not. I don't want to be a. It's a very big barrier for me to have to get over, for me to be friendly with someone who is willingly and happily proud of that Confederate flag, is waving it around and saying that this is a part of who I am and I'm never going to let this go. Congratulations. I don't want you to forget about your ancestors, but the things that your ancestors did to the people that looked exactly like me, no, thank you.
They don't wear the clothes that they wore back then. I don't see them running around in, like nobody's running around in wigs either. I mean, we progress, so I just don't. So what would you think if you came across a man who had like a rebel flag on his shirt, like without you speaking to this person, what do you think their mentality is? This man's mentality, like how do you see him as a person?
That's a really good question, and I'm a strong believer in like benefit of the
sure, just, right?
Yeah, right. So depending on the age of the person, so I have to be honest. If it's a young like 20-year-old, and I know because I'm 25, right? I know what it feels like to be a part of a crowd, to be a part of a group. So that's why I empathize with those people. And it's gonna sound crazy, but I empathize with those people that are in those 8chan, 4chan group chats, because that is their form of family. If you are part of those kind of groups, you feel like these are the only people that are speaking to the feelings that I have. So I want to empathize with those young folks that are joining these crazy super far right, crazy, hardcore, racist, anti-Semitic, whatever situation groups, right? So first of all, if they're young, I'm going to be like, look, you can find people who care about you, love you, are going to treat you like you are a part of their team, part of their family. That has nothing to do with racism. That has nothing to do with respecting the heritage that hated an entire group of people just based on race. But at the same time, like I said, I have to be honest, it's a barrier. What I'm going to think about that person is that person does not like who I am as a human being. So I'm just going to I'm not going to converse with that person unless I have to. Jay, I'm not going to put myself in a situation where I have to argue my humanity with someone. So yes, I feel for them. I can try to understand why they're doing what they're doing, but I'm not going to put myself in a situation where I have to argue that I am just as human as they are, or I deserve the same things that they deserve. And yes, I am making that assumption that they look at me as lesser than, but that's what I see in that flag. That flag shouts to me, you are less than I am, if it's someone that's not black that is wearing that flag.
And you have to think, these groups like you were talking about, like the neo-Nazis, there's a reason why that's part of what they fly around. That's why it's a part of what this group wears, what this group chooses to represent them. They choose a swastika. They choose the rebel flag. And I mean, even the KKK, like a couple years ago, they were up in New York handing out brochures to these children and leaving them on doorsteps. And guess what? The person on the front of the brochure had a rebel flag. Why do you think that is? I mean, it's not a really difficult concept to grasp.
Right. Yeah, no. Yeah, like you're not taking a huge leap of faith to say, oh my goodness, it's a coincidence that everyone that has a neo-Nazi flag also agrees with the people who like the Confederate flag. That's not a goddamn coincidence. That's not a coincidence, right? So when you had those people march, and I'm sorry, I think was it in North Carolina with the Jews will not replace us, good people on both sides. Donald Trump. Was that in North
I don't know.
Carolina?
I know there was one in Charlottesville, Virginia.
Virginia. No, it's definitely Charlottesville,
And
Virginia.
then they came up to Boston right after that, but it was a very few amount of people. I was in Boston during that time.
Oh wow! Well,
yeah.
Well, good for you. Go Boston. I'm from Boston, but
me too. Great place.
Yeah, woot woot, go Pats. We just won today. But yeah, no. When you see that happening, it's not a coincidence to see them waving the Confederate flag. It's not a coincidence that those same group of people that are literally shouting down another group of people just based on what they believe in is also waving a neo-Nazi flag. So, like, you're right. You don't want to make these judgments, but if you consider yourself not racist, if you consider yourself not anti-Semitic, if you consider yourself like the most open human being ever, but you also love your heritage and want to hold on to the Confederate flag, you have to ask yourself the question, why do the people who actually hate Jews also like this flag? Why do the people who actually hate blacks also like this flag? And if you are justifying, oh, they just believe something totally different than me, but they also like the same things I like, there has to be some kind of justification in your heart, or you are just lying to yourself and you actually believe that you are better because you're white, you are better because you're not a Jew, you are better because you're a man, whatever the bigotry that you have in your heart, you are either justifying it or you're lying to everybody else, and you know what you feel, and you do agree with those hateful people.
That is so well said.
Jamie, I've been like ranting all day, and like you are the greatest host I've ever. I don't
Except
know
for
how
not
much
being on time. I'm sorry.
Stop it. I don't know how much nursing we actually talked about, but like I think about this all the time, and I think to be a nurse, you have to understand like human beings, and to understand human beings, you have to understand the good and the bad. And I think we had such like this is like the deepest conversation I've ever had on any this is something special. It might be a little too much. I don't know what the downloads for this episode is going to be like, but this is I enjoy, like, you are fantastic.
Oh, well, thank you. I've loved talking to you all this time too. I can't thank you enough for agreeing to talk to me.
Yeah, no. It's like, I don't know, because when I do my nursing news videos, it's just me and the camera.
Yeah.
So sometimes I'm a little afraid to go like really talk about how I feel specifically. But when someone asks you how you feel, you let loose. So
yeah, right?
So you gave me the permission to let loose, and I feel really good about it. So I don't know, judgment, no judgment, whatever you receive, I would love to see what happens. Like, but like, just what I'm trying to say is thank you. Thank you for allowing me to speak the feelings that I felt for a very long time. So just thank you. Thank you for letting me for your podcast to be my vent.
Anytime that something comes up to you and you're like, you know what? I feel very passionate about this. Shoot me a message. We'll record about it. We'll make it a thing. Because I loved having you on and talking to you. Oh, good. And it's mutual. So I'm going to have to sometime have you on my side, and I will have to flip it. Or like I said, I'll probably just end up cutting a lot of this up and posting it on my YouTube channel, on my podcast, because we had some conversation. I mean, this is legit, girl. Jamie, you're doing something special, girl. I'm telling you, you're doing something special. Thank you. That means a lot to me. I really appreciate that.